Sawasdee krab. Good morning, everyone. I hope you're all well. My name is Midnight from Thailand. I am the Executive Director of APCOM, which is a regional organization working in the Asia Pacific region on health, rights, and well-being. I am so sorry for not being able to join you for this important meeting to align strategic directions and developing joint actions for the Global HIV Prevention Coalition. Thank you very much for inviting APCOM to join the coalition. And our organization started in 2007, and it has its roots in the HIV/AIDS movement. And thank you for also giving me an opportunity to say a few words on this session. What an exciting time that we're in for HIV prevention. We now have an array of different tools in our toolbox, including now oral PrEP and long-acting injectable PrEP in the fight against HIV transmission. Just imagine you're a community person and having this as a real option on the ground, and then you can readily access them. But as we know, even after a decade or so, the uptake of the PrEP has remained low in many countries around the world. And in my region, in the Asia Pacific, the reach of PrEP is less than 3% of the target, which is so abysmal. The absence of domestic investment remains to be a critical gap, which prevents the scale-up of PrEP programs for key populations. And there needs to be much more of a political push and leadership. This is most critical within the current funding environment, and we need to do much more to target advocacy with governments. And in order to effectively address the HIV epidemic, it's crucial that community-based organizations that we know play a key role in both the advocacy side and also on the implementing prevention choices, including PrEP as a program as well. We have evidence already that PrEP is effective in preventing HIV transmission amongst key population. But in this current environment where funding is declining, we really need to ensure that the community-led services can still continue because we know it plays such a key role. And we know this during COVID-19, how important it was to have that existing trusted services for our communities that are most marginalized, and to ensure that our work in the prevention side continues. We need to also continue to sustain this service delivery on the ground. I would also say that the community education is so important to ensure that communities keeps up to date with new intervention methods and what's coming in the pipeline. Through our annual community summit, last year, APCOM found that the community's understanding around the injectable PrEP remains really low and it's not as comprehensive as the oral PrEP. And then I think through the education through the community, we can really scale that up. What is needed to advance our work within the thematic actions and ensure efficiency in synergy within the different elements of prevention? In my humble opinion, I think to be able to have data on the benefits of investment in prevention. So what I mean is that, for example, in terms of life saved and contribution to the economy, cost of efficiency instead of the lifelong treatment, and the effectiveness in terms of investing into community-led services for key populations. How do we make this how do we as coalition members, be able to have the same language and data to be able to present and talk to the policymakers, the governments and donors. And I think with these numbers, it would really help the consistency in our advocacy messages. To end, I would like to congratulate the Global Prevention Coalition for the report on the key findings from the 2023 Global HIV Prevention Coalition Scorecard, which was aptly named HIV Prevention from Crisis to Opportunity. So, like, how do we then look at this as an opportunity now to really ramp up and revitalize the prevention um, scale up for key populations. It's such a great report, and for our work to go forward, we need to also be more tuned to the needs of the region, as mentioned in the report, and to the key populations and the groups that we are working with to really close the prevention gap and to expand and scale up prevention for our communities that can become a reality on the ground. Thank you very much for this opportunity, and I look forward to working with you going forward. Bye.